Hi, I'm Disha, and our group's topic is experiential therapy. So, I'm going to talk a little bit about what it is, when it is used, and how it is used. So, experiential therapy is a therapeutic technique which uses expressive tools and activities such as role playing, acting, props, arts and crafts, music, guided imagery, and various forms of recreation to reenact and re experience emotional situations from past and recent relationships. The client focuses on the activities through the experience and begins to identify the emotions that are associated with success, disappointment, responsibility, and self esteem. Experiential therapy is often used in the treatment of trauma, eating disorders, behavior disorders, anger management, grief and loss recovery, substance abuse, and other types of physical and behavioral addictions. It is recommended for those who wish to be free of pain and grief and who are unhappy and who have bad feelings from past experiences and to change the nature of their current relationships that they are forming and developing and to encourage this client to live up to their full potential. Experiential therapy is offered in individual, clinical, and medical settings, including various types of recovery treatment and rehabilitation programs. How it works is experiential therapy is based on one's perception, which determines one's behavior. By re experiencing and releasing repressed emotions that are negative from the past, the client is better able to experience positive feelings such as love and forgiveness and being calm in the present and really changing their perception of reality. Experiential therapy can take a variety of forms and is mostly client centered. And in that, the client's preferences for certain interventions are honored and are taken to the best degree so that uh, workers can make sure that the client reaches their full potential. And experiential therapy is just a really good form of therapy to allow people to take time to absorb all that has happened in their past and really work to moving on from it and strengthening themselves and finding better ways to cope with their emotions and to also change their perception in life and in people and to just work in terms of making them stronger as an individual and to also ensure that they have recovered from their pain successfully.
Hey Disha, thanks for letting us know what experiential family therapy is. Now that we know what it is, let's go look at the brains behind who is responsible for developing experiential family therapy. Yeah. So first off, we have this guy named Fritz Perl, should be on the screen right now, who was born in Germany and alongside his wife coined the term Gestalt therapy, and they developed it around the 1940s. Both him and his wife had an extensive background in psychology and psychoanalysis, and they developed this new type of therapy as an alternative to psychoanalysis. So during a similar time, there was this other guy named Carl Whittaker, and he was born in New York, born in 1912, and he was kind of the founder of experiential family therapy. So the reason that he developed experiential family therapy to begin with was he was in the field of psychology, and what he realized was that a lot of these patients that would come in, they'd get treated and get sent back home, that the symptoms that they initially had and that were treated would resurface when they'd be sent back home. And so he realized that family was an integral part of treating and help treating these patients. And so he was extremely influential within this field and worked alongside notable names like Thomas Malone and Austin Napier, who are also very prominent and notable figures within this community. And so we have other notable names like Walter Kempler, who worked with Fritz, the German guy that I mentioned before. And he was also big on the similar thought and wavelength as Whittaker, along the lines that the entire family was essential to the therapeutic process. And so those guys were the kind of the founders, the kind of the guys that laid the foundation for what experiential family therapy is today. And then obviously that we have the guys that are pushing this field forward and are the modern ambassadors of experiential family therapy. And so those guys being Laura Roberto and David Keith, and they've had multiple years within this field. They're extremely well knowledgeable in the field of psychology, and they've written multitude of different books around family experiential therapy and the great results. And some of these books being Defiance in the Family, Finding Hope in Therapy, and Symbolic Experiential Family Therapy. Yeah, if you guys ever want to give it a read, go ahead. So, is this type of therapy used within CYCs or among CYCs? And the answer to that is yes. Although we're not therapists ourselves, within the family-based practices that we do and the approach that we use, experiential family therapy, a lot of that stuff is mixed within the family-based approach that we have and the family-based approach that we use in our day-to-day child and youth care work. We understand and acknowledge how important family life is within the therapeutic process, and that's something that we learn just through working with youth and having gone to school. And as important as the family-based approach is another thing that we learned is evidence-based approach. And so it's also important to look at the literature that talks about this. And there is an abundance amount of literature out there talking about how we implement experiential family therapy within our child and youth care work. All in all, it's thanks to the amazing contributions of the multitude of different men and women that gave up everything so that we have the understanding and capacity to utilize the knowledge that they've given us when we work with the children and youth day to day. And as we continue to learn more and as we continue to develop this field and to learn more about the psychology and the family therapy in general, it is our responsibility to continue to learn, to continue to seek the literature and read the literature, to continue to have evidence-based and family-based approach within our work and continue to do everything to keep learning and to do our best to help the youth and children that we work with. And so that's everything from me.
Hi everyone. Next, we're going to talk about what are the traditional techniques identified to this type of therapy, which is again the experiential therapy, and how have CYC advanced these techniques, and how do traditional techniques connects with this relational practice, which is again the experiential therapy. So first we're going to talk about what are the techniques in this therapy. So these techniques in this therapies varies on type of various different types of experiential therapies because it doesn't just come in one form. It has different types of therapy and therapeutic intervention that focuses on an actual movement. This therapeutic technique uses tools and activities that are expressive, such as role playing, acting, props, arts and craft, music, animal care, guided imagery, or various forms of recreations to reenact and re experience the emotional situations from past to recent relationship of an individual client. Experientially therapy are techniques that are used in treatments of trauma, anger management, substance use, and other mental health issues that combine an evidence-based approach as well. Experiential therapy techniques help individuals to discover emotions, build self-esteem. Individuals gets to learn, navigate, and let go of negative feelings. In a CYC perspective as well, experiential therapy focuses on the potential of individuals and guides them to enhance how they relate, think, and feel about the outside world. CYC practitioners are thinking ways to maximize therapeutic benefits of experiences to meet the client's needs. With this work of CYCs are the structures of their agenda. So experiential therapy is about experiencing, processing positive emotions, which connects to relate the relational practice, as it is about the approach that attention is directed towards the concepts of being, interpreting, and doing that focus to historic context, trauma, or culture.
Hi, everybody. I'm Devon, and I'll be talking to you all about activities in this form of therapy as well as its relation to the work CYCs do with families. As mentioned earlier in this video, this form of family therapy uses expressive techniques and activities to help clients re experience and process situations from the past which in turn can help people find resolutions for their underlying issues, such as mental health problems and or substance abuse. For example, psychodrama is one of the most common activities used in this therapy, and practitioners implement this activity with clients so that it could help them address issues that affect their mental health by creating and acting out a scene from that individual's life, hoping to help them gain a better understanding of their experiences. So I found that one study looking at adolescents who have experienced trauma found that the use of psychodrama helped improve feelings of safety, self-image, and coping skills. And another study on post-traumatic stress disorder found that psychodrama and trauma-focused experiential theories help to reduce PTSD symptoms by 25% in the first 2 to 3 weeks. So looking over all this whole theory, it reminded me of 2 of the 25 characteristics of relational child and youth care practice. And those 2 characteristics are participating with others as they live their life and meeting others where they are at. So I feel that practitioners taking the time to sit down with families and helping them learn and develop by doing tasks with them instead of just telling them to figure it out goes a long way when helping them promote positive change. Unlike the common interpretation of therapy where it's revolved around sitting in a formal setting, talking face to face to therapists, experiential theory has families actively engaged in hands-on activities while in environments they find the most comfortable. It is through this that they can learn to identify and focus on what they're feeling as individuals and as a collective unit. It is also more beneficial to help clients find a success in their own environment because I feel that it gives them a sense of hope, knowing that they have the power to spark change no matter where they are in their current situation. And with that being said, that brings an end to our video. I hope you guys taken away something from the experiential family therapy. And on behalf of Disha, Nam, and Samantha, I'm Devon, and thank you guys for listening.